Hello, everyone. Sorry about the little delay there. Had a little technical difficulties. This morning, I was planning to interview a colleague of mine, Dr. T. Colin Campbell, but he had a slight emergency and we had to reschedule. So, what I want to do is discuss another topic with you this morning. And there's an interesting concept I have been thinking about over the last several months, more so in the last few weeks, and it's the concept of disease suppression. As you know, I've talked a lot, and there's a lot of talk about the coronavirus infection and immunity. There's a lot of talk about how many individuals who have chronic illnesses and who are, of course, older are more susceptible to becoming seriously ill and dying from this viral infection or any viral infection for that matter. And this whole concept of disease state, suppressed immune system, suppressed cardiovascular system, suppressed, endocrine system. So the concept of disease state is one that's been very prevalent. So what I want to do is discuss the whole concept of disease suppression. So we often talk about reversing diabetes or reversing heart disease. So are we truly reversing diabetes? In our clinic, we see many patients, thousands of patients over the last 2 decades, nearly 2 decades, where we've put them on a natural lifestyle regimen, nutrition, exercise, sometimes supplements, and we quote unquote reverse, their diabetes. That means like, they've been on insulin for, 3 decades and they'll go on a nutritional program and they'll come off insulin. Their blood sugars will be well controlled. They'll come off antihypertensive drugs. Their blood pressure is controlled. We've had a number of individuals who have low ejection fraction, where their heart is weak. They have congestive heart failure. We put them on a nutritional regimen and their heart function improve. And so the issue is, are we reversing the disease? Are we suppressing the disease? And I think there's a combination of both that's there. I think early phases of the lifestyle change, you suppress the disease state. By that, you can reverse some of the physiology, reverse some of the adverse biochemistry that's happening, and get the patient or the individual in a condition where they are feeling better. For example, you have someone who's on insulin and they come in and you put them on a nutritional regimen. Their physiology and biochemistry changes in such a way that they no longer have to take insulin. Their blood sugars are controlled naturally. And let's say they follow that program for several months and this condition continues, but then for some reason, they revert back to the old lifestyle. They may have a situation where their blood sugar is no longer controlled. They may have a situation where they may have to go back on insulin or other medications to control their blood sugar. So you have a situation there where you have suppressed their disease state, but if they don't maintain that lifestyle long enough, then that recurrence of disease state may happen. We see this with heart failure patients, hypertension patients, and so on. So we definitely know in the early phases, we are suppressing the disease state. And what we have seen in some patients over a long period of time, if they maintain that lifestyle, then you tend to have what may be thought of as a reversal. But it's all a matter of determining, what's happening biochemically and what's happening physiologically. So early on, you have disease suppression. And it's possible that later on, maybe years later, then the body goes into a condition where maybe if they did regress a little bit, they would not have the same type of regression physiologically and biochemically as they would early on. So you have this concept of disease suppression, which I think is an important concept. And let me show you some things from a PowerPoint slide that I had shown. And this is from some of our work. Hold on one second while I share my screen with you. So what I want to do is share this with you. Let me go to a large screen. Let me see if that works okay. This is one slide from one of our publications. And this is the data from a group of 31 patients where we put on a nutritional detox. And on the nutritional detox, we saw at baseline, the systolic blood pressure was between 140 and 160 millimeters of mercury, and it decreased down to below 140. diastolic blood pressure went from above 90 millimeters of mercury on average and went down to below 90, around 84, 85 millimeters of mercury. So you see in a 4-week period of time, there's a suppression of the hypertension. Similar with the cholesterol, you see a reduction in cholesterol, reduction in LDL. Now, often individuals will talk about disease reversal, but here we have a situation where they have a suppression of disease. How do we know that? Well, if we look at the next slide, we saw that the same individuals who took on average 2.6 medications per person per day went down to 1.6. So the same individuals who were on, and we actually showed the reduction in antihypertensive medication as well as reduction of other medications as well. So the same individuals who required almost 3 prescription drugs per day went down to less than 2 prescription drugs per day when they were on this nutritional regimen. So not only do you have an improvement of the biochemistry and physiology, in this case, the physiology, the blood pressure, you also had a reduction in the requirement of antihypertensive medications, or medication in general that was needed. So you had a true suppression of disease state. Here's some data from one of our other publications where we showed the reduction in lipoprotein(a) and other inflammatory markers. Inflammation, as you know, is a critical factor in the disease state. And so here you see about a 16% reduction in LP(a), total cholesterol and LDL cholesterol was reduced, small dense particles were reduced. And so we saw here, or see here, that you can suppress disease states with a certain nutritional regimen. Let me go down, I'm gonna skip a few slides, and I want to discuss a patient that we had who came into our clinic. So here's a real life situation, a gentleman in his 60s who came in who had very elevated blood pressure. His heart rate was very high at 122 beats a minute. His blood pressure is 170 over 111. He was edematous, swollen, short of breath. This gentleman wasn't feeling well, so we had to put him in the hospital to initiate care. He was admitted to the hospital that very day. While in the hospital, we initiated a nutritional detox regimen in addition to making medication changes. His heart rate was very fast. He was in, this is the EKG, showed him in an abnormal heart rhythm. We call this heart rhythm atrial flutter. That's a medical cardiology term, meaning that there was an abnormal electrical circuit rhythm from the upper chamber that causes heart to beat faster than normal. But over the course of several weeks, we put this individual on a nutritional regimen, and not only did he get better, he was able to improve his condition. Let me show you some information. His renal function. So GFR stands for glomerular filtration rate. Sorry for the technical aspect of it, but the higher your GFR, the better. In other words, the faster your kidneys is filtrating your blood. Glomerular stands for kidney, or the glomeruli, the basic units of a kidney. So the filtration rate of the glomeruli represents the filtration rate of the kidney, the rate at which your kidney is filtering the blood. You want the kidneys to filter the blood at a faster rate, so the higher the number, the better it is. If the kidneys are not filtrating the blood faster, there's a molecule of protein that we measure called creatinine, and that number will go up. So the higher the creatinine, the lower the filtration rate. The faster filtration rate, the lower the creatinine. So in the courses, and I'm sorry I didn't give you dates on here, but this is a course over several weeks, probably about 2.5 months, that we showed where his filtration rate, the kidney function, improved with the nutritional regimen. So here's clear evidence that he starts off at 0.1 with near kidney failure. Notice that a glomerular filtration rate below 15, which would be right about here, will declare him for dialysis. So he was very close to having to go to dialysis. Despite that, on this nutritional regimen, the nutritional detox, his kidney function improved tremendously. His filtration rate went up to almost normal, while at the same time the creatinine went down to almost normal. So here you saw a suppression of the disease state of kidney dysfunction or kidney failure. We look at another data set, the albumin. The albumin is one of the main proteins measured in the blood. A normal albumin level is somewhere around 3.5, 4.5. His albumin level when he came in was only about 1.7, 1.8. So when we put him in a hospital, this is albumin level, we put him through a detox regimen and his albumin went up. Now, many people think on a plant-based diet that you can't have, you don't get adequate protein. But here we saw the protein levels go up on a raw plant-based diet. And we see here where it drops again. This is after he had oyster soup. So he introduced animal protein in his diet. And we saw a sudden drop in his protein. We took him back on a raw plant-based diet and his protein levels went back up. So why is this the case? Well, as I mentioned, disease state suppression is what we're thinking about. So the physiology of disease is it consists of the underlying processes that cause an outward manifestation. The outward manifestation could be elevated blood pressure, elevated cholesterol, low albumin, or many other things. In this case, the underlying manifestation in his situation was inflammation. He had systemic inflammation that affected his kidneys, affected his liver, affected his vasculature, to where his blood vessels or capillaries were leaky and albumin leaked out of the blood vessels into what we call the interstitial space or the third space. So he had low albumin because the albumin was leaking due to the inflammation that was associated with the small blood vessel leakage. When we put him on a raw detox, we turned off the inflammation. And we have data showing that inflammation reduces over 30% within just 4 weeks. Much of that happens within the first week. And what we saw here is that when you placed on a raw detox diet, that suppressed the inflammation and therefore suppressed the disease state. So the albumin improved in a similar fashion that you saw the kidney function improve. So inflammation was affecting the renal system, it was affecting the liver or hepatic or GI system, it was affecting the vasculature. You had swelling and edema, which also improved over time. So the disease state was suppressed. However, when he reintroduced the wrong foods, it didn't take very much. It triggered the switch back on the disease state and his albumin dropped. He also did have some dip in his kidney function, which again re-improved after we reintroduced the plant-based diet. So the raw detox regimen is a process by which we use to suppress disease state. And this whole concept of suppressing disease state is an important concept because oftentimes we make lifestyle changes and we get better, but then we regress on those lifestyle changes and our disease states can recur. This whole important aspect of suppressing disease state is an important one, largely because we have to be mindful that it takes a longer period of time to truly reverse the physiology. There's a larger period of time of reversing things, and sometimes it takes a longer period of time to suppress some conditions compared to others. We saw changes in this gentleman within days to weeks. Sometimes it can take months. Some individuals, some inflammatory conditions can take months. Some vascular conditions such as hypertension or heart failure may take months to reverse. But we've seen it, to be suppressed. But we've seen this happen over time. We've had the unfortunate situation with some individuals with severe heart failure come in, follow our program, get recovery. They suppress the heart failure, suppress the underlying condition of the heart failure. However, they regress and go back to the adverse lifestyle, and unfortunately, they regress. Their heart failure returns, and we've had some individuals who didn't survive that regression, and they passed on due to heart failure. So in many situations with severe illnesses, it's important to, once you've gotten the disease state suppressed, maintain that level of lifestyle for a prolonged period of time. And that's why we develop support systems and work with our patients in terms of food procurement, food preparation. We have online programs to help them out. But it's an important concept to keep in mind. The concept of disease state suppression is an important one to keep in mind. And we want to make sure that you understand that. So we look forward to having Dr. Campbell later this week. We actually rescheduled to this Thursday. It's going to be 9 o'clock Central Time and 10 o'clock Eastern Time. So I look forward to visiting with Dr. Campbell on the special topic of the antiviral effects of a plant-based diet. So until next time, stay safe and continue to follow us as we'll bring more information to you throughout the week.